Hi everyone, thanks for joining today. My name's Anna Mitchell. I'm one of the stud vets at B&W Equine Vets, and this presentation is on foaling, what you need to know and when to call for help. It's certainly not fully comprehensive, but we'll focus on some of the important aspects. So we'll be looking at preparation for foaling, the normal stages of labour, immediate post-foaling care, and then we'll look at some of the more common problems when things go wrong. So first, looking at a suitable area to foal down. So in this country, most people foal down mares in foaling boxes, so large, stable. Ideally, the floor is concrete with or without rubber mats, which enables more effective cleaning and disinfection than something like a dirt floor. And disinfection is really important, particularly if we're having more than one mare foal down in one stable over a season. And really a lot of attention needs to be paid to that. Ideal bedding is straw, ideally wheat straw. This is much more suitable than shavings, which can work their way into little small crevices, including newborn foals' eyes and things. So straw's ideal. Foaling paddocks can also be suitable places for mares to foal down. If they're managed well, they can be clean, they're spacious. The challenges associated, which don't make them suitable for everyone, are that obviously the fencing needs to be foal proof. We don't want foals rolling out under the fence at any time, and also setting up a suitable monitoring system in paddocks can be, depending on the situation, can be trickier than in a stable, but obviously very dependent on the individual situation, and certainly foaling paddocks can be really successful. So as foaling approaches, the normal physiological things that happen to the mare include the udder filling, so getting larger sort of 2 to 4 weeks prior to foaling. The muscles around the tail head relax, and the vulva muscles relax as well, and cause elongation of the vulva. The teats tend to engorge around 4 to 6 days prior to foaling. And then we see waxing up of the teats. So this waxy secretion of colostrum that accumulates at the end generally happens around 1 to 4 days prior to foaling. And these events really vary a lot between mares in terms of when they occur. So this is just a general guideline, and this is when knowing the due date or knowing breeding dates is really helpful, because then we can, as these events occur, we can see if they're happening at a sort of a normal stage of gestation, or are they happening prematurely, which might raise some alarm bells. And as we get closer, so sort of 2 to 4 weeks from foaling, if your mare has a caslix stitch, so where the top of the vulva is sutured, that will need to be opened to avoid her tearing during foaling. And so here we can see the procedure being performed, and we generally use it in these mares with abnormal vulvar conformation that are so very sloping vulvas like this image here, and with mares that are more likely to suck in muck and air. And so some abnormal signs that we can see in the run-up to foaling, so running milk or seeing vulva discharge in the weeks or months running up to the due date is abnormal, and definitely warrants veterinary investigation. So the general aim should be that each foaling is attended without fail. Hopefully the mare will go on to foal without problem, won't need any assistance, and the person present will hopefully just need to observe and do nothing further. But it is really important to have someone there to detect problems early if they do arise, and to act quickly if needed. Having said that, it's also important that the monitoring is done discreetly. So horses are prey animals and have evolved to generally foal overnight when the risk of being preyed upon is lower, and the the same effect can be seen, although a domestic mare is not going to be preyed upon, but certainly if there's a lot going on, so either in the yard in general, or a lot of noise, or a lot of in and out of the stable, the mare is likely to hold off and not foal while she's being sort of interrupted. So the more discreetly you can monitor, so either through some from a little bit of a distance, or through some boards here in this picture here, the more she can exhibit her normal behaviour and get on with labour, and not be unsettled. And this is particularly important with maidens or other anxious mares that may become unsettled more easily. The history of the mare is really important, so general health history, but also history of previous foalings. So has she had previous uncomplicated foalings, or has she had previous problems, so a foal getting stuck, or perhaps a bleed after foaling, something like that. And it's important, if possible, to be aware of these previous problems and discuss things with your vet before things happen. And the other thing to consider is sending the mare to stud to foal down, and this can be really invaluable in a lot of cases. These professional studs are completely set up for foalings. It's what they do every day of the breeding season, and they have the equipment, the monitoring equipment, the personnel, the experience and the expertise to detect problems quickly and act quickly if needed, and this can sometimes be the difference between life and death, and it can really be invaluable in a lot of cases. So while most mares fall down without complications, it's worth being prepared in case things don't go completely smoothly, and having a plan for that situation, so that which you can implement quickly if things do start going south. Having your vet's phone number to hand, so by a yard phone or in your phone, or just somewhere that everyone can access it, can really reduce unnecessary stress in when it's most needed, and when time really is of the essence. Having a clock that's easy to hand, that everyone can glance at, and record the events of labour, and therefore pick up when things aren't going smoothly, or when there is a problem. That's really, really important. Having a foaling kit ready, which we'll go through, and also a red bag kit, which we'll also discuss later on. So in a foaling kit, the basics include a torch, mobile, which you probably will have anyway, having a clean bucket with some soap, and cotton wool to clean off the mare's back end as things start, and a tail wrap as well to get that out of the way, some clean towels to rub the foal with, some latex gloves, oxygen. If you're falling down a single mare in a season, you may well not have oxygen, and that's not necessarily wrong. Obviously, the big studs, and if you're falling down multiple mares, then can be a sensible thing to have. Umbilical dip, which we or your vet can supply, and generally a fleet enema is worth having to in your kit, just to help get things moving once the foal's born. So looking now at labour and delivery, so stage 1 labour, so this is where the uterine contractions start. It is variable in length, but often lasts 1 to 2 hours, and the signs that you're looking for are basically mild to moderate signs of colic. So she'll be quite restless, circling, flank watching, lift her tail frequently, may urinate frequently, and may be up and down a fair amount. And then the end of stage 1 labour is marked by the rupture of the chorioallantoic membrane, so that's the waters breaking, and that indicates the start of stage 2 labour. And during stage 1 labour, those contractions starting are what cause rotation of the fetus. So in late gestation, so up here on the top left, the fetus is in this position, and so with and during stage 1 labour, it needs to rotate round completely to be in so it's upside down initially, and then needs to rotate round so it's in a kind of diving position. and that's what's happening in stage 1 labour. So it's a pretty crucial part of a normal parturition or normal birth. Stage 2 labour starts with the waters breaking, or those placental membranes, the chorioal and ptois, rupturing, and this is when the clock is really, really essential, and this is when time is of the essence, and I can't sort of reiterate that strongly enough. So unlike in other animals where even the cow or dogs, stage 2 labour can be pretty variable, it can be quite long. In the horse, really anything more than 20 to 30 minutes after the waters break and before the foal is born is abnormal. So we really need to be starting that clock and delegate someone to be on clock duty and to keep track of that. Really, because of travel time and things, if you see the waters break and then there's no significant progress, so you're not seeing a lot of the foal poking out within 10 to 15 minutes, really you should be on the phone to the vet, and they can, and maybe hopefully things are still progressing normally, but it's always better sooner rather than later in cases of foalings and possible problems. It's always better to call rather than not. And as we mentioned before, the normal presentation is this nose diving. So I won't show you this whole video, but basically this is stage 2 labour. As you can see 2 feet, and then that's a little nose up there, pushing out there. And normally the mare will be largely down for a lot of stage 2 labour. She may get up and reposition and go down again, and some mares will foal standing up, which is definitely less than ideal, but often they're down. Stage 3 labour begins after delivery of the foal and ends after the placenta is expelled. So the placenta should, in normal cases, is passed within 3 hours. It may be pretty much straight after foaling, but it should be, to be normal, it should be within 3 hours. If it's retained and it's still hanging there, but after 3 hours, then definitely call your vet, and then keep the placenta for your vet to examine to make sure it's all intact. So here we can see one that's it's not always necessary to do this at all, but this placenta is being inflated with water, and you can see it's completely watertight. It's all filling up with water, which shows it's intact. But your vet will be able to just examine it and appreciate that whether it is intact or not. So immediate post-foaling care. So as soon as the foal's out, we're going to be monitoring really carefully, and pretty much straight away the foal should be at least attempting to right itself and sit up. And hopefully at this stage it should still be attached by the cord to the mare. And that obviously won't be the case if the mare unfortunately folds standing up, but if she folds lying down, then they should still be attached. And the longer they stay attached, within reason, the better, in terms of the fact that the foal gets a good amount of its total blood volume via the cord after it's been born. So we want to not to prematurely break that cord. And normally the cord will either break because the mare moves or because the foal is trying to get up. And once it has broken, then the umbilicus can be treated with the naval treatment. Normally chlorhexidine is the better than iodine for treating umbilicuses with. And in the meantime, while the cord is still attached, we can just let them sit there and develop a bond while that blood transfer happens. The 1-2-3 rule is a really simple but useful guide as to whether the mare and the foal are progressing normally after birth. So a normal foal, after a normal foaling, the foal should stand within 1 hour of birth. It should nurse, so probably latch on and have a good suck within 2 hours of birth, and the placenta should be passed within 3 hours of birth. And it's pretty reliable in terms of if those events don't take place within those time frames, then we're concerned that things aren't progressing as they should, and definitely call your vet if those haven't happened within those time frames. We definitely want to hear if that's the case. So ongoing postpartum care, which we're not going to go into in detail, but the foal should be breathing normally without excessive effort. It should be bright and alert, not just standing dull. the mare should be bonding. They should be bonding well together. She should be attentive, nickering at the foal, and the foal should be nursing well, and the mare should be allowing the foal to nurse. So sometimes, particularly maidens that are sort of over attentive, will, as the foal goes around the back to nurse, she may follow him round and prevent him from being able to latch on. So that kind of thing you want to be really wary about happening, and give us a call if there are any concerns with that kind of thing. And in between nursings, newborn foals sleep a lot, so the foal should appear satisfied. You should be able to lie down and rest and sleep, and then pop up again and go straight to nurse once it pops up. But really resting well in between. A foal that sort of stands around looking dull after nursing, or just doesn't seem to work out how to lie down, or is always at the udder, sort of pestering at her. All those things can be abnormal signs. So meconium. So the first stool that's passed is dark and can be quite pebbly and sticky, and it's generally passed within 12 hours. But generally, we recommend giving a fleet enema soon after birth. Generally, once the foal's nursed, give the enema, get things moving. There'll be more than just what came out with the enema to pass, but it can get things moving and hopefully try and prevent any impaction from developing. Urination happens a bit later, particularly in fillies within 11 hours, and colts normally a bit sooner, normally within 6 hours. And a normal, healthy foal, you may not necessarily see doing like first urination, but that's what we're expecting time frame wise. And after birth, the mare should remain bright, alert, as I say, attentive to the foal, nickering at the foal. Can definitely be offered food and water, and the water intake should really be it's going to be increased the demand that she has during lactation, and so she should always have available fresh clean water, and it's quite marked how much that demand does increase during lactation. She should be monitored for signs of colic or discomfort after foaling, and generally I think it's a really simple and valuable tool to monitor rectal temperatures twice a day over 2 to 3 days. It can just highlight early on a problem developing, and uterine infections are not uncommon in mares, even if whether or not they've retained the placenta, and it can really allow us to get onto things early if we're keeping an eye on temperature. So when things go wrong, so dystocia or difficulty foaling is the incidence of this varies between breeds. So there's a higher incidence in draft breeds and actually miniature breeds as well. We don't have that. This isn't a draft in the picture there, but anyway, and higher than, so the rates in those breeds are higher than thoroughbreds. The first sign of a dystocia that you may see is the prolonged second stage labour. So the waters will break and the mare may strain and be pushing, but no real progress is being made because that foal is obstructed. And it may be that the most common reason for dystocia is that there's a malpresentation or a malposture of the foal, so it's not quite in the right position. So the normal presentation, as we said before, is this diver's position, so two front feet and followed soon after by a nose. So things that can cause a dystocia and stop second stage labour progressing within the normal time frame. So, for example, if they have a front limb flexed, that will cause them to be stuck. Hind limbs or posterior presentation is abnormal, so either with hind limbs extended, as in this case, or a true breech where the hind limbs are flexed and tucked under the foal, in which case you can just, putting a hand in, you can just feel a tail. Those can all cause dystocias. And then transverse presentation, so basically we just feel either basically just feel four legs coming towards us and the foal's kind of like sideways on. So with managing a dystocia, time is of the essence in terms of getting a live foal and a live mare, and also minimising damage to that reproductive tract of the mare. And that is why the clock and the timing of second stage labour in particular is so important. So if things aren't progressing and we have either a malpresentation, so abnormal, one of those abnormal presentations that we just saw, or for some other reason the foal is just stuck. So the first go-to that your vet will do is attempt assisted vaginal delivery. So that's manual assistance, either just pulling with hands or with chains or ropes, and that, you know, and for some abnormalities, some abnormal presentations, that will be sufficient to deliver the foal. Other options include a controlled vaginal delivery. So this is where we anaesthetise the mare. So she undergoes a general anaesthesia, and then, as you can see in this picture down at the bottom right, and she'll be suspended by her legs while she's under anaesthesia, and that will the anaesthesia will help relax the uterus, and then the elevation of the hind legs will help. Basically, the gravity will help to make more space. The foal won't be pushing out so much, and so we can push the foal back in further, correct the abnormality, and then deliver the foal. So if assisted vaginal delivery and controlled vaginal delivery are unsuccessful, a caesarean section can be performed. So this is what's happening in these images, a mare being prepped for C-section here on the left, and then the uterus being exteriorised from the abdomen at the top there on the right, and then the foal being resuscitated on down here on the right. And the likelihood of a successful outcome for both mare and foal from a caesarean section can be good. A lot of it depends on the time from the start of the problem, so the start of the dystocia, to when she makes it into surgery. And so again, highlighting the importance of really stringent timekeeping when assessing mare's foaling. And then the last option is a fetotomy, which can be done if we're certain that the foal is dead, and this involves removing parts of the dead fetus inside the mare to then enable it to be delivered, with the aim of of saving the mare and for the mare to go on and do well. So it can be effective in that really unfortunate situation. In general, we recommend before pulling to wait until your vet arrives, because once you start pulling a foal, the risk of the placenta separating is really high. So basically, once you start pulling, you're committing that foal needs to get out very quickly to give it any chance at all, because it's going to get deprived of oxygen very quickly, and will die if it doesn't get out quickly. So. And it also, there's a risk of damaging the mare's reproductive tract as well. So in general, we recommend waiting until your vet arrives before doing too much intervention. The big exception is a red bag delivery. So red bag delivery, so a normal delivery, when the water's breaking, is the rupture of the chorioallantois. So this is the blue line here on the diagram, the chorioallantois, and it ruptures at the cervix, and then the foal is able to push out through there. The rest of it stays attached, the chorioallantois, so the rest of the blue stays attached, the umbilical cord stays attached, so the fetus still has a blood supply, and then it's delivered. So in the next membranes which are the white membranes that we see surrounding a foot or whatever, and that's the amnion, and that's what we see when a foal is delivered normally. So in a red bag delivery, rather than rupturing normally at the cervix, the chorioallantois, it just detaches all around, and so there's no blood supply to the foal, and the whole, and then we don't see the waters breaking, we just see the chorioallantois protruding as this pink, not the nice white normal membranes, but this pink red chorioallantois protruding from the vulva, and we don't see any fluid being expelled. So And that's what a red bag delivery looks. And that's the most urgent foaling emergency, and it must be opened immediately and the foal delivered. So either using scissors or your hands or anything, because the foal doesn't have, well, while that's detached, the foal doesn't have any blood supply and won't last long. So it's the kind, if you see that, by all means call your vet at the same time, we can talk through it, but we're not going to be saying, okay, wait till I get there, because that will be too long. So that's why it's so urgent. So when I said in the preparation list, have a red bag kit ready, basically some gloves, some scissors, a tail wrap just hanging outside the stable is quite handy, just in case, and hopefully you won't need them. So then on to other post-foaling complications. So retained placentas, as we discussed, so the definition of that is of a retained placenta is retention after beyond 3 hours of foaling. So dystocias or difficult foalings predispose to a retained placenta, but it can occur in any mare. So again, timing, being vigilant on timing is important to identify when that has occurred. And they're pretty urgent. A mare with a retained placenta needs to be seen urgently. And the reason being that the complications that can occur from it, so big uterine infection, so metritis, endotoxemia, so sepsis, can lead to laminitis. And laminitis is often, if it gets to that stage, that's often the life-threatening complication. And that's why aggressive treatment from the get-go, when it's diagnosed, is needed. So clinical signs, don't necessarily see anything initially. You may not see the placenta even hanging out, because it can be that just a part of it's retained, like most of it's been expelled, but there's just a little tag of placenta in there, so you may not see that externally. As the metritis and the infection develops within the uterus, then we start seeing fevers, endotoxemia. She's going to be dull. She's not going to be eating, and then the laminitis signs. Diagnosis, the most important or the best way to diagnose is for us to examine the placenta. So we'll lay it out, and so we can identify both uterine horns. So this is the pregnant horn that the foal was in here, and then this is the non-pregnant horn that was empty during the pregnancy. And we're going to be specifically, the most commonplace part of the placenta that's retained is this tip of this non-pregnant horn. So here we're going to be looking at that and making sure that there's nothing missing, basically. If there's a tear or a little bit missing, even if the dogs have got to it, it has to be on our minds. Is it still retained within the mare? And so we've got to ask that question to ourselves, and we've got to follow up enough to be sure that that's not the case. So we're going to be looking at the general exam of the mare, doing a uterine exam, and we may ultrasound scan via the rectum to look down onto the uterus. And we may do blood work as well, particularly if she's got a fever or anything. So treatment is largely, so we'll flush out the uterus with large volumes of fluid to get rid of that. It gets pretty yucky pretty quickly. Start her on systemic antibiotics and anti-inflammatories. Give her oxytocin to help squeeze out anything that's in the uterus. And if she becomes sick, she may require hospitalization and supportive therapy, things like fluids, cold therapy for her feet if we're concerned about laminitis, that kind of thing. But some will be able to get on quickly at home with flushing, and she won't look back. Others, will retain for longer or become sicker and need a bit more intensive therapy. Another complication post-foaling is hemorrhage. So this is where there's a rupture of a large artery that supplies the uterus. So this is an example of one of the vessels that can rupture, and it lies within the broad ligament, which is the structure that sort of suspends the uterus within the abdomen, and that's a common one that ruptures if it occurs. The signs that we see, so the mare will be distressed after giving birth. So may appear as colic. She may be up and down. She may be rolling. She may be sweating, very pale. Eventually become pale gums. Very high heart rate as she loses blood through that bleed, and she may progress pretty rapidly, depending on the size of the vessel and the extent of the bleed. These can die pretty fairly quickly. Others will be more controlled and, will only show perhaps mild signs and can certainly, some can absolutely be controlled with treatment and these mares can go on to do well. But if you suspect this condition or you have a mare that's distressed or colicky post-foaling, keep her as quiet as possibly and confine in a stable and your vet will be on their way. So causes of postpartum colic. So these mares that have just given birth are at increased risk of colic in the immediate time after foaling. Suddenly the reason for that is suddenly there's a lot of space where that was being occupied by the foal, and now there's a lot more space and those internal organs can move a lot. There's an inflammatory response to foaling, and there are changes in the gut bacteria. And the gastrointestinal tract can just become really bruised from birthing, and that can be enough to cause colic. And again, your vet will be able to advise you on the how to go forward from a mare that's colicking post foaling. Another complication post foaling is a uterine tear or a rupture of the uterus. So again, there's a higher risk of this occurring after a difficult birth or a dystocia, but it can occur following an apparently normal birth. And so the signs that we see are generally mild to moderate colic, so generally not necessarily thrashing around, but just a bit quiet, not right, a little bit uncomfortable, dull, not eating, high temperature, and all resulting from the fact that this uterus has got a tear and there's infection then tracking into the abdomen, a peritonitis. So we can generally diagnose this. Initial diagnostics are an abdominal ultrasound, and we may see increased fluid, and we can take a sample of that fluid, doing a belly tap to look for evidence of infection. And if we find a peritonitis, so infection within the abdomen of a recently foaling mare, a uterine tear is high on the list of causes. In most cases, surgery to explore and repair the tear is necessary. Occasionally, if it's a very small tear, it might they can occasionally heal themselves with antibiotics and fluid and supportive care, but more commonly than not, surgery is needed. So lastly, back to something cheerier. So routine vet checks, assuming that everything has gone really smoothly, the mare's foaled, you're happy with the foal, happy with the mare, then what we recommend, assuming she foaled overnight, we would do a newborn foal check in the morning. So we'll check the placenta, check it's intact, check it looks normal, and do a really thorough physical exam of the foal. We often give some tetanus antitoxin as well. And then at 18 to 24 hours, we recommend coming back to take some blood to look for IgG levels. So these are the antibody levels in the foal that the foal receives through drinking the mare's colostrum. And generally, if they don't receive enough antibodies, so either because they didn't drink enough volume of colostrum or because the mare doesn't have very good quality, so just colostrum, so just has low antibody levels in that colostrum, and if that foal doesn't receive enough and has low IgG levels at 18 to 24 hours, then it really puts it at a disadvantage and increases the risk of it becoming septic and sick in its early life. And generally, if we diagnose that that's happened early and that it hasn't received enough, it doesn't have high enough IgG levels, then we can give it a plasma infusion, and that can really boost its IgG levels really effectively and give it the start that it needs in life. So we've come to the end of our whistle stop tour. I hope you found it useful. If you have any questions at all, please don't hesitate to contact me. My email address is on the first slide. But otherwise, I hope you all have a great breeding season. I hope everything goes really smoothly, and thank you for listening.